Today, we're diving into the causes of lung cancer. Now, you might think you already know the whole story, but trust me, some of the answers, and especially how long we've known them, are pretty surprising. So let's kick things off with a little piece of history that might blow your mind. The link between smoking and cancer? It's not some 20th century thing. A physician named John Hill first documented it all the way back in 1761. That's right, we've had the first major clues for over 250 years. And understanding all this is absolutely vital. Why? Because lung cancer isn't just some common disease. It is the #1 cause of all cancer deaths worldwide. Okay, so before we really break down all the different causes, let's just quickly get on the same page about what this disease actually is and the impact it has. At its very core, lung cancer is pretty straightforward. It's a disease where cells in the lungs just start growing completely out of control. This usually gets started in the alveoli, those are the tiny little air sacs, or in the bronchi, which are the tubes that bring oxygen into your lungs. All right, now for the single biggest factor in this entire story. There is just no way to talk around it. Smoking is by far the main culprit. And this slide really shows just how definitive the connection is. Think about it like this. For every 10 people who are diagnosed with lung cancer, as many as 9 of them have a history of smoking. The link is just overwhelming. To really understand the risk, you have to look at this number. People who smoke are up to 30 times more likely to get lung cancer than people who don't. That is not a small increase. That is a massive, massive multiplier. And this number right here, this explains why. A single cigarette contains over 7,000 toxic chemicals. These toxins just hammer the lining of the lungs and can literally change the structure of your DNA. And that's what allows those cancer cells to start growing and form tumors. But, personal habits aren't the entire story. Let's broaden the view a little bit and talk about the dangers that can be hiding in our environment, often completely invisible to us. Secondhand smoke is not just some minor annoyance. It is a major risk factor. It contributes to over 7,000 lung cancer deaths every single year, and it affects people who may have never smoked a single cigarette in their lives. Now, this slide shows 2 other key toxins you might find in your environment. On the left, we've got asbestos, a mineral fiber that you can still find in a lot of older buildings. But look to the right, that's radon, a radioactive gas that occurs naturally. And here's the crucial thing about radon. Right after smoking, it is the second leading cause of lung cancer. So that brings up a really important question, right? Especially with something like radon. How in the world are you supposed to detect a threat that you literally cannot see and you cannot smell? Well, thankfully, there are some very clear, actionable steps you can take. First things first, test your home. You can hire a professional or you can use an at-home kit. And if those levels come back high, step 2 is to get a ventilation system installed to bring them down. The environment can hold other risks too. It's also important to be aware of certain heavy metals. I'm talking about things like arsenic, which you can find in contaminated water, as well as chromium and nickel. These can also increase your risk. So we've shifted from our environment to risks that are, well, a lot less controllable. Let's talk about our own genetics and our demographics. And yes, genetics absolutely play a role here. If a close family member, a parent, a sibling has had lung cancer, especially a specific type called small cell lung cancer, your own risk might be higher. It's because of inherited genetic mutations that can make you more susceptible. Demographics also show us some really important patterns. As this chart shows, Black men are more likely to get lung cancer than white men. The source material also points out that racial disparities in healthcare can affect the likelihood of getting treatment, like surgery, which in turn can affect survival rates. And there are a few other demographic factors to keep in mind. Age is a huge one. Most diagnoses happen after 65. Men also face a slightly higher risk. And believe it or not, even your location can play a role, especially in some rural areas where tobacco use might be more common. So after going through all of these different risk factors, from smoking all the way to our own genetics, where does that leave us? Well, it brings us to our final and most empowering section, lowering your risk. Because knowledge really is power. When you boil everything down, the 3 most impactful steps you can possibly take are crystal clear. Number 1, quit smoking. Number 2, avoid secondhand smoke. And number 3, test your home for radon. These actions directly target the 3 biggest causes we talked about. So, we'll leave you with this final thought. Now that you know the risks and you know the most effective ways to reduce them, what is one choice you can make starting today for your own lung health?